So this is protocol 1, which is vertical treatment protocol. Not every patient should be laying down horizontally in face up or face down position and stretched like an accordion. This is an intermediate step. Usually it's called protocol 1 because it's the safest bet when you have an acute disc herniation, severe pain, say 5 and over, or a patient cannot lay down because of the pain or cannot get up because of the pain. So you treat them and you distract the spine, a little decompression by moving the leg piece, mobilizing and extending. And of course you can, if it's a lateral herniation, a medial herniation, or you can change the position of the leg piece to open up that area. And then you can work the spine up and down, flex it, and extend the leg piece. So you're decompressing it at multiple angles as required by that patient. And extending it, retracting it, extending it. And of course the patient is instructed to pull up as I go down. Little therapeutic exercise is important to help and relax when I come back up. And pull when I come down. Pull up. That increases the force of distractive force on the spine. It helps create better effect if the patient participates in the therapeutic exercise. And then we can change the angle a little bit more. If we want to open up the other facet joints for facet syndrome or sacroiliac, we can open up these joints and stretch on the right side. And we're allowed to also do some manual mobilization techniques to stretch the hip flexors and extenders and adductors. We're stretching the psoas muscle, we're stretching the quads, and we're working on individual segments that may be diseased from the MRI. We're relaxing your leg. We want to check rotation, internal, external rotation. With this restriction, we're gonna do a little bit of maneuver, but first we're gonna stretch this out a little bit, bench knee. We're gonna work on the TFL, tensor fascial latator muscles, the abductor muscles, and then we're gonna work right into the joint and push any fluid that's accumulated in. We're gonna stretch the piriformis muscle for piriformis syndrome. Then we're going to work a little bit of our signature mover to restore some movement to the hip joint with all the interconnecting muscles from the lumbar spine to the hip and from the lower extremity into the hip. Everything, this is grand central station. So if you release the pressure and the stress here on the piriformis, gluteus maximus, gluteus medius, insertions of the hamstrings, we're going to release that now, a little bit of an impulse movement, and release it, good. And then we release that, we freed up both the spine, sacroiliac joint, and the hip joint. Now there's increased range of motion. And the gentleman can now play a better golf game.